Thank you for watching today. This video is an educational video. My name is Charles Moore. I'm a nursing student. Today we're going to be talking a little bit about how to prevent pressure ulcers and also how to identify pressure ulcers. So today I've came up with a word or an acronym, CARE, C-A-R-E. And this is how we're going to use steps to memorize, or an easy way to memorize how to take care of patients and prevent those pressure sores. So the C is for change positions. A, assess skin. R, remain active. And E, eat a well-balanced diet. So what we're going to do now is we're going to go visit a patient that has been recently discharged from the hospital and talk to the caregiver and help give this information and provide them these easy steps to help prevent pressure sores. Okay, here we are with our patient. This is Granny. This is her daughter, Darlene. So, Granny, just tell us a little bit about what had you at the hospital.
A woman rear-ended me and put me in the hospital with my back.
So it was an automobile accident?
Yes.
And you hurt your back and your neck?
Yes.
Okay. So you had surgery?
Yes.
Okay. And you just got discharged from that surgery?
Yes.
Okay. All right. And so, Darlene, you're going to be helping take care of Granny while she's kind of in the state where she's not as mobile as she used to be?
I am.
Okay. So before we get started, we're going to go over a few things and a few steps to help take care of your skin and prevent any pressure ulcers and any skin breakdown. So before we get started, Darlene, do you have any questions about what we're going to be talking about, or just any general care?
What would I be looking for on her skin?
Okay, great. I'm glad you asked that. We'll go ahead and cover some of those things in a few moments. Okay, Darlene, so now I just want to explain to you a simple acronym that I've came up with to help prevent some of these skin breakdowns and skin pressure ulcers. And it's as simple as CARE, C-A-R-E. And the first one is the C, and that's to change positions. So what we want to do is every so often you want to change your position or redistribute your weight. So for instance, as you're sitting in this chair, Granny, what we want to do is every 15 minutes try to shift your weight to a different side. So maybe shift it to the left a little bit, and then after 15 minutes or so, perfect, just like that, to move it around, and then shift back in another 15 minutes or so. And what this prevents is where we have your skin is close to your bone and there's not a lot of tissue in between. What happens is with the weight of us sitting on it, like near our tailbone, pressure is put there. And what happens is this doesn't allow the skin to receive the oxygen and nutrients it needs through the blood flow. So in a result, what happens is the skin begins to break down and basically die. And that's what happens with a lot of these pressure ulcers, and how they start or how they form. So C, we always want to change position as we're sitting in a chair. So if we look at the situation in a bed, so if you're laying in a bed, about every 2 hours we want to position from maybe our left side to our right side, to our back, to our stomach. And in the next clip we'll take a few looks on how to position and maybe some pillows that'll help prevent some of these breakdowns in the skin as well. Okay, so now that we have Granny in the bed laying position, now we're going to demonstrate some of the techniques we would use using pillows and a soft foam mattress to prevent some of these pressure points. So Darlene, would you like to go ahead and demonstrate for us, maybe rolling her? It's been 2 hours. Granny's ready to be rolled.
All right, Granny, if you put your hand, if you roll over just a little bit right there, I'm going to position this.
Good.
Okay, now you can roll back over. It just gets that weight off of that hip right there, and that shoulder.
So Darlene, why is it important that we put the pillow behind her?
Because we don't want her to lay flat.
Exactly. So that helps push her back and hold her that way, so if she begins to roll back. Another important thing that you can use is they have the foam or gel mattress tops. You could lay it under. That would prevent pressure as well. We could also take another pillow and then we could lift it. Can I get you to lift your feet up for me a little bit? Good. The other one? All right, good, good. Lift it right here, and what this prevents is the heels from touching the bottom of the bed, and that'll prevent pressure on the bottom of those heels, and that'll help prevent any skin breakdown from the pressure there. So those are just a few tips on how to position pillows, and using you can also get foam cups to go under the heels. That'll help prevent pressure as well. So those are just a few techniques and tips. Okay, so now that we've changed positions, we're going to look at A, and that's assess the skin. So what we're going to do is talk about what we're looking for to see when an ulcer or pressure ulcer may be beginning to develop or possibly has already developed. So Darlene, what are some areas on the body that you think that we would look at first, some of the key areas you think we would start looking?
I would think maybe the heels.
Okay, absolutely, because they're one of the lowest points. And then, of course, like where the tailbone area is, elbows, your back, and possibly even your head. I mean, of course, because it lays on the pillow. So those are a few areas that we would search. Of course, we would do head to toe and look at all the skin. But what we're looking for is we're looking for redness. We're looking for swelling. We're looking for, even if you feel it, you can feel the heat. Some other things, maybe bruising. So those are some things that we would look for to identify if a pressure ulcer is beginning to develop or has already developed. Now, once they've already developed, they're a little more easier to detect. You can sometimes see even a break in the skin, could be bleeding, and those are some of the signs that we would look for as we assess the skin. So you would look closely from head to toe. You would also look to see if the skin has changed in any type of color, if it may be shinier or if it's swollen. Those are some of the things that we would look for as we assess the skin. Alright, also when we are taking care of the skin as far as cleaning it and washing it, we want to use a mild soap. We don't want to use anything that's real harsh on the skin, or even like the fragrance is real strong. Some of those things can be agitating to the skin. We want to make sure that we keep the skin dry. So areas that may contain moisture or may be harder to dry off, such as under the arms, in between the thighs, around the back area. So what we want to do is when you're drying these patients, we want to make sure that we pat them dry. So we don't want to rub them and agitate the skin and could cause more damage to it. So we want to pat dry. We want to make sure we keep them dry. And then even if they're using briefs, we want to make sure that the briefs are changed often, and that'll prevent from the moisture to continue to cause skin breakdown. Okay, so we've looked at C, A, and now we're at R. This is remain active. Now it may sound kind of silly that she's in a bed or even in a wheelchair to remain active, but there are still small range of motion exercises that we can do to keep the body in motion, to keep the blood flowing. That'll help circulate and get that oxygen and nutrients to the skin. So for example, Granny, we could have you lift your arms and bring them back down. And if we did this 10 times throughout the day, this would help range of motion as well as that blood circulating through the skin. For example, lifting the feet up just slightly off the bed, or pointing the toes, there you go, and down, and then pointing the toes away from you and then back to your head. So those are a few exercises or movements that you can do even bedbound. Okay, just a few more examples of some range of motion exercises that we can do even while we're in a chair. So Granny, let me have you take your right leg and just lift it up and bring it back down. And so we could do that, a couple repetitions of that. We could take our arms and bend them straight out, and we could do circular motions. We could bring them up above our heads, bring them down. All right, good. Now something that may be a little bit more challenging for those, but as they continue to recover and become stronger, we could do what we call a wheelchair kind of push up or sit up. And we're going to take our hands and place them firmly on the rest and just simply push up as much as good and bring it back down. So we can do repetitions of that. So there's little bitty exercises that we do to continue to keep us active. And again, that'll keep that blood flow going and help prevent prevent the skin damage, as well as get that oxygen flowing, circulating, so it'll provide that oxygen and nutrients to the skin that we need. Okay, so now we're on our last letter. So we've talked about the C, A, R, and now we're on E, and that's eating a well-balanced diet. So what we want to keep in mind when we are looking at our diets is fluid. We want to keep our intake of water up. This will help keep our skin from being dry and cracked and damaging easily. We also want to eat a well-balanced meal each day.
How would I know how much she eats and what she needs to eat?
Okay, good question. So that can be tricky trying to determine on what meals to provide, how much, how many calories. The government has set up that we have a website that's available to us. It's www.choosemyplate.com. and there you have tips and resources that'll provide you with how much calories she should have, as well as the types of food to provide to receive the right nutrients needed. Now also, in addition to that, you could seek counsel from a dietitian to receive possibly like supplements for protein and vitamin C and all the other vitamins that may be necessary. You also can look at Ensure, possibly in between meals, supplements to that nature as well. Okay, so as we wrap this video up, I hope that everything was very easy for you to remember, that you learned some quick tips on how to prevent pressure ulcers. And just to remind us, Darlene, what does CARE stand for?
CARE. C for changing position, A for assessing skin, R for remaining active, and E for eating a well-balanced meal.
Perfect. And so it's that easy. It's that simple. Just those 4 letters in the word CARE. So we would like to thank you for watching this video, and I do want to remind you that if you do notice during your skin assessment any skin breakdown or formations of pressure ulcers, to please contact your healthcare provider. Again, thanks for watching this video.